Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our update on the coronavirus pandemic in the country, in Maryland, and also here at GBMC. So we've now been in a period in Maryland of roughly 2 weeks where the number of people sick enough with coronavirus 19 to make it into the hospital has been relatively stable. We've been at a plateau. The test positivity rate across the state has been a bit above 5 and now is a bit below 5. And we are happy that we have not seen the number of sick people increase dramatically. Having said that, I need to let all of you know that the hospital is a bit pressured because of the fact that this has gone on very long. And like many industries, we have been seeing a deficit in some areas of our workforce. So we are grateful for everybody to continue to wash their hands, continue to wear masks, and continue to social distance. You may have seen in the news there have been some people upset with mask requirements. I need to remind people that the evidence is clear. Masks work to prevent the spread of the coronavirus. And it is in people who have the virus and don't know that they have it that the masks are going to be the most effective. And that is why many school districts in particular have gone to mandatory mask wearing. Once we get out of the pandemic and the epidemic of cases, and the cases become very few and far between, because most people in the community are immune, then we can consider relaxation of the mask requirement. At this moment, masking is still a very important part of our armamentarium against the virus. At GBMC, right now we have 22 people who are sick enough to be in the hospital with the coronavirus. That is more than the last time we met. The number has been holding steady, just like the state numbers, but we will again be very happy when the number drops off and we can get back to usual business. We have 6 patients in the intensive care unit. We have 1 of them sick enough to be on a ventilator. Of the 6 people sick enough to be in the ICU, 4 of them have not been vaccinated. 2 have been vaccinated, and 1 of those 2 is an elder. And we now know that elders are less likely to maintain the level of immunity needed to keep them from getting very sick, even if they have been vaccinated. Which brings me to our next topic, which is the FDA's approval of the Pfizer vaccine for a 3rd dose for people 65 years and above. That 3rd dose will add some protection for people that have had 2 doses of the Pfizer vaccine. We are awaiting for the final word from the Centers for Disease Control and Prevention before we begin the rollout of a so-called 3rd shot or booster dose to those people. We have already been giving it to people who are immunocompromised. And let me also talk to you about the importance of getting your flu shot. As you know, influenza presents at this time of the year and through the winter. We are expecting the first cases, and we want to make sure that everyone is protected. The other thing is the hospitals are already a bit stressed because of the number of coronavirus patients that we still have, so we really need the general public to get their flu shot. Flu shots are now available. GBMC Health Partners is starting its distribution to its patients next week, and we will continue to immunize people as they come in for their shot. So that's the update for today. As usual, we are very, very grateful for the community's work at washing your hands, maintaining social distance, wearing a mask when appropriate, and of course, getting the vaccine. We are here for you if you need us at GBMC. We wish you the best. Thank you very much.